is the KUSI News at 6.
And despite the assurances of the president, there are still a lot of questions about the healthcare overhaul, including these early benefits the president mentioned today. KUSI's Ed Lenderman is in the newsroom now with that part of our coverage for us. Ed?
Heather, the president's comments come as the White House meets with state insurance commissioners and CEOs of major insurance companies amid concerns over continued premium hikes.
A number of these consumer safeguards, what the administration is calling a patient's bill of rights, were supposed to be implemented in a couple of days. July 1st, the start of a new fiscal year. But it appears the new target date is September 23rd, 6 months after the president signed the health care reform bill. Today, Mr. Obama touted the fact that soon most health insurance plans will be barred from turning children down due to pre-existing medical problems. But local insurance broker Craig Gussin says the bill was written so poorly, insurance companies do not have to accept such a child. Only if they take the individual do they have to cover pre-existing issues, he says.
Unfortunately, Congress doesn't understand the ramifications of how healthcare works. And the bill they put together sounds great on paper, but when you start realizing it, it doesn't work.
California, he says, is going to put together another high-risk pool for such people. But again, meeting the original timetable of July 1st is going to be impossible.
I don't know of anybody that's going to have the high-risk pool up and running, including the government, July 1. So a lot of the things that sounded good and we all want, it's just not feasible to get something up and running within 3 months.
Something that will take effect on July 1st is financial help for seniors regarding Medicare's so-called donut hole. Seniors are now required to pay 100% for prescriptions when the cost goes over $2,800 up to $6,400.
They said, okay, to help these people to 2014 when it goes away, we're going to give them a $250 check. That is actually what I read this week is going out this week to a lot of people who have already met it. But $250 isn't a lot of money to people who are at that stage.
As we said before his speech, Mr. Obama and other administration officials met privately with state insurance commissioners and CEOs of major insurance companies. The message: the administration will aggressively confront what the president calls unreasonable premium hikes. But Craig Gussin says if you're going to have to insure millions of people who otherwise can't afford coverage, rates are going up. Heather.
Well, Ed, this guarantee of health coverage for children with pre-existing health problems, that's only if the insurance company accepts the individual first. What kind of a guarantee is that?
It does sound confusing. Gussin says there's no language requiring a company to insure such a child. Only if the company accepts the individual does it have to accept whatever health issues the child has. So this is something that's going to have to be looked at, and you're right, it's very confusing.
It is, because it doesn't sound much different than what was already in place. So, all right, Ed, thank you very much for that report.